In my opinion, I think it needs to evolve to include more personalized care where people have a lot more independent monitoring at home.
So I exactly agree, Sana. I think that it's all about moving towards a more individualized version of healthcare. And this is really what's at the core of Access Safia, is trying to give individuals information and make health conversations much, much more proactive, make information more readily accessible.
Data isn't being shared effectively, and so you see a lot of primary care and secondary care, the information isn't shared. So the problem in our profession is that medication error can happen because people don't know, they don't have the appropriate records in front of them to establish the correct treatment for that patient. But there is a lot of virtual monitoring now made possible by technology, and so the virtual monitoring of patients and patients monitoring themselves at home, so patient empowerment is empowered also by technology.
So mobile health is definitely an interesting area, and I really think it's up and coming because you see a lot of mobile health apps right now in the startup space. And at first I pushed it away and said, mobile health is so complex because if you don't have a smartphone, what access do you really have? But SMS and things like that are also a potential. And I think it lets the patient receive more information and take control of wellness.
The ideal healthcare system includes free healthcare for everyone. It also includes a system where all segments of healthcare communicate with each other, and I don't mean like different hospitals, but I mean a hospital versus a long-term care center versus a rehab center, so that everybody gets that information, because I think there's also a lot of impediment to the patients of accessing their own information between facilities, which hinders healthcare and access actually. And I also think there would be more access to low-cost technology to assist patients in monitoring their own health and being proactive.